versatile, quality of life getting better.
Hi guys, welcome to today's health talk. My name is Omotolani Olajumoke Falayi, and today we'll be discussing about cholera. You all know there is cholera outbreak in some states in Nigeria, so we'll be addressing that today. And with me is a colleague of mine. Welcome, sir. Can you tell us your name?
Alright, my name is Olawale Bekele. It's nice to be here.
Alright, thank you so much, sir. Today we'll be talking about cholera, and I would like to ask you, sir, what did you understand by cholera?
Alright, actually, cholera is an infection of the intestine caused by bacteria. And in case you don't know, the bacteria is called Vibrio cholera. Yes, Vibrio cholerae bacteria. So that's it, that's the cause.
Alright, welcome, sir. Can you tell us how can cholera be transmitted?
Alright, majorly, cholera can be transmitted through contaminated water or contaminated food. However, there are other causes also, other ways in which it can be transmitted, which is through poor sanitation or when you have direct contact to somebody that is infected. You can get it. That's just it.
Alright, thank you for that, sir. Can you tell us the symptoms one may experience if they have cholera?
Okay, alright. When you talk about the symptoms of diarrhea, of cholera, well, we have symptoms such as severe diarrhea. And what do we mean by this? That involves water getting out of your body. That's like watery water. Yes, normally, as human being, there's a level of what you are supposed to release in terms of water from your body. But when it becomes excess, that is diarrhea, and it is one of the symptoms of cholera. Then vomiting, which vomiting can lead to dehydration, and it's also part of the symptoms of cholera. And also dehydration itself, that is when you have a dry mouth, low urine output, it's part of diarrhea. And also muscle cramps, you understand. Then rapid heart rate, yes, when you dehydrate and the way your heart beats and the likes, it's faster than it ought to be, it's part of the symptoms of cholera. Then low blood pressure, please. So if you notice any symptoms of this, the best way to verify what is really wrong with you is to visit an hospital.
Alright, thank you for that, sir. I really gain a lot. And can you share us the do's and don'ts to engage with? What are the do's to engage in, sir?
Alright. Well, for you to avoid the effect of cholera and its likely tendencies, what you are supposed to do first and foremost, make your environment clean. Like, that's the priority. Like, have a clean and safe environment. So, and also drink safe water. Consume only boiled or purified water. So don't just drink any water you don't know the source. Please don't just take it. You understand? So if you are going to take water, most probably it's going to be probably pure water or bottled water. Make sure it is from a clean source. Then also wash your hands thoroughly with soap and clean water, like I said earlier. Also eat only thoroughly cooked food. You understand? So don't just eat anyhow food. Don't just eat a food that you don't know whether it is well cooked or not. Also dispose human waste safely. Yes, human waste safely. Please do that and maintain a clean surroundings like I mentioned earlier. Then always seek medical attention if you notice any of the symptoms we highlighted earlier.
Alright, thank you so much for that. How can cholera be managed, sir? What are the things not to engage in? How can it be managed, sir?
Okay, well, this is not far-fetched from the earlier answer I gave. Well, do not eat raw or uncooked seafood. Also, avoid fruit and vegetables that have not been washed with safe water. Some of us will just enter anywhere, get vegetables without making sure it is clean. Please avoid it. And also, anything that has to do with contaminated water for cooking or preparing food, please avoid it. Once you know that the water is not clean or safe enough, please avoid it. Don't risk it. Also, if you have any symptoms of this, like I said, don't ignore medical attention first. Visit an hospital to check what is really wrong. Then Do not contribute to environmental contamination. Yes, dispose of waste properly. Don't just do it anyhow. Then do not consume untreated water. Very, very important. Please take note of that.
Thank you so much, sir. We are so glad to have you on the show today. Thank you so much, sir. And I would like to tell you to register on our platform at www.posatai.org.ng as a client for free or as a service provider for 1,650 naira for amortized monthly subscription package, which offer full virtual office assistance, product, service cataloging, plus 6 and networking. And you can also download the Posatai app for free on Google Play Store and drop questions for the Posatai doctor for free in the chat room. You can also get to us through this number +234 7038338723, or you can email us through this email details info@posatai.org.ng. Posatai, quality of life getting better. Thanks.
Posatai, quality of life getting better.